Sometimes the story comes close to home. Mary Baxter covers the Southwest for Ontario Hubs, and that was the case this week for her, reporting on the role of patient advocates in our health system. She's in our studio at Western University in London, and she joins us now to explain. Welcome to the show, Mary.
Hi, Jayanne.
Now, this is a little different from our usual Hubs check-ins. This week, you got a little personal in your latest story for TVO.org. You found yourself in a difficult position, acting as the advocate for your sister Sue, who has severe mental health issues as well as Parkinson's. Can you tell us about Sue's journey?
Sure. Sue she's actually 63. She's lived with severe mental illness since she was in her early 20s. She has something called schizoaffective disorder, which is a combination of, has features of both a mood disorder and schizophrenia. And about a year and a half ago, on top of all of this, Sue's been in and out of hospitals for most of her life. And on top of this, about a year and a half ago, she was diagnosed with Parkinson's, which is actually something that runs in our family. Her symptoms progressed very quickly. By last spring or early summer, she was having a lot of difficulty getting around. She was challenged in getting up out of her chair, out of bed. She wasn't able to cook for herself. She wasn't able to dress or shower by herself, all of those sorts of things. She lived alone. We were working on trying to get her into some form of assisted care under the mental health system, but it was taking time. We had home care assistance, or we were offered that. They initially told us that they would be able to provide Sue with someone to help her in the morning and at night. That never happened. All that we ever got was 2 visits a week. So that meant a lot of that fell on me because I was the only sort of active family member close enough to her. And as you can imagine, with her condition worsening, there came one morning where she wasn't able to get out of bed. And we had to take her to the hospital. And the doctors there admitted her because they wanted to see if there could be some changes in her medication to get her more mobile. So she did that. That was midsummer, and about 10 days later, there were some improvements. One thing I haven't mentioned is with Sue is that she's lost her ability really to speak. She can try, but she doesn't know which word to use. She often gets very mixed up. She gets confused with understanding. She's had quite a cognitive decline. So we got to the point where it was time to talk about what happens after hospital. And the doctor came in, there was someone there from home and community care, and there was the hospital social worker. And Sue and I talked about it. We talked, well, maybe it's time for Sue to go into long-term care. We wanted an application for consideration for that. We asked for that. We asked for it repeatedly. The hospital staff did everything they could, and the home care staff to dissuade us. They wanted Sue to go back home where she lived alone, to wait without what we'd already seen were not adequate home care supports. She would have been back in emergency within a week. And the more we pushed, the more they resisted. She was lucky, though, at the same time as we were doing that, the psychiatrists, both at that hospital and another hospital, which has monitored her condition for quite a while now, worked on her case and got her transferred to the other hospital, where she was able to things started to improve. They changed her medication a bit more. Things started to improve. She was more mobile, but still severe cognitive decline. And at that other hospital, she waited a period of 7 months to actually get into a group home under the mental health care system, which is where she is today. She moved in there in February. She's much happier, but the group home, which does give her someone there that's 24 hours to monitor her. I, as her disease progresses, that may not be adequate for her either.
Now, Mary, of course, your experience clearly shows there was some gaps in the healthcare system, but there's something in your personal essay that caught my eye. It's a term I think a lot of people are not familiar with. It's the term bed blockers. Can you explain what that means?
A bed blocker is, as I say in my essay, it's a pejorative term. It actually refers to people who have been assigned to something in hospitals called alternate level of care. Or as they say, ALC for short. What that means is that that's someone who has gone to hospital for treatment. They've done the treatment, they've done all they can. That person is no longer in kind of acute need, and they're discharged, but they're too vulnerable and they're too frail to go back to whatever living circumstance they might be. So they need to have additional care in order to keep safe, and they end up in hospital. We've heard a lot about these people. We've heard a lot about how they've contributed fairly significantly to the crisis, the bed crisis that we currently have in hospitals. But there's some things that get left out in that discussion. One is that those people are there because they're not safe at home. They're there because they have a right to be there.
I'm curious, is there something in your view that either the hospitals or the healthcare system can do to improve these so-called bed blockers and the process as well?
Well, I think the province is really trying to rearrange the system so it's a bit more seamless in terms of trying to organize those placements. But one of the big things that I noticed in the issues that we experienced was that there was no one there on our side. The person and the people who had actually been assigned that responsibility in law to us seemed to appear to be more supportive of the hospital's bed crisis than of my sister's needs, and truly solving those so that my sister could remain safe. I think what we really need in hospital systems now, like they do in the mental health system, in the mental health system, they have someone who's not paid by the hospital who can provide advice or advocacy for a patient who is undergoing certain procedures that are governed by the Mental Health Act. I think we need a similar kind of advocate or advisor that is independent from the hospitals and that is in each and every one of our hospitals here in Ontario. It may not solve all of the problems, but it would ensure that patients receive very clear and information about what happens with their aftercare.
With that being said, were you able to speak with anyone from the Ontario government for this story?
Yes, we did reach out to the provincial government a couple of weeks ago to obtain comment. They did respond in the final hour. They did note that some of the activities that went on that my sister and I experienced, which was pressure to leave the hospital. They did note just generally that hospitals should not be pressuring patients in that manner. They did emphasize the restructuring that they're working on with long-term care that they're hoping will address some of these issues.
I'm curious as a caregiver. This is obviously a story that I'm sure a lot of people can relate to in this province. How do you find peace and stay balanced while, going through such a hard time with your sister?
I think one of the things that one has to remember when you're trying to support someone who is very, very ill is you have to remember the person, because when that person's gone, we remember the person. We're not going to remember the illness. And we have to remind ourselves as we're going through that to spend that time and to take the breathers to be with that person. And I think that's important because that's what it's all about. It's, those connections and those relationships, and to spend time and recognize that even at its worst, there are times in those relationships we can have good moments.
Mary Baxter, I want to thank you so much for bringing this story to us, a very personal one as well. I imagine it was very hard for you to write as well, but thank you so much for sharing it here. That's Mary Baxter, our Southwestern Ontario Hub journalist.
Thanks, Jan.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.